recording. And we go to this option, and we should switch on the sound, the volume, and we start sharing, and here we are. And from current slide. Okay. So we've listened to the conversation of Mr. Martin and Dr. Martin and Mr. Wood, and we discussed the pain, the character of Mr. Wood's pain. Okay, just a minute. Somebody is going to join us. I see. Okay. And we move on. And what we are going to discuss now is, so we should focus on language and the tenses which are used in the present and complaint. And we had a chance to listen to the use of these tenses.
One more student is also in the waiting. If it shows to you, please.
Just a minute.
Add her also.
Oh, I don't see this person.
Okay.
There are 12 participants, including me. I mean, me and 11 students. Is somebody missing?
Yes, ma'am. One more should be there.
Ma'am, one more student should be there.
Just a minute. I need to do what? What should I do? So. It doesn't show that somebody is waiting in to join us. This is the problem. Is he really waiting?
Yes, ma'am.
Okay. 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 No. I see. Madhumita, right?
Yes, ma'am.
Is it okay now?
Okay, ma'am. That's fine.
Yes, ma'am.
Well, and we close this and we go there, and we go back, and so if we speak about the group of tenses which is called present tenses. So you remember that there are several just tenses, grammar tenses. This is present simple, present continuous, present perfect, and present perfect continuous. And why do we speak about them now? So understanding the time patients are referring to when they speak is crucial to making a correct diagnosis. And the question is, what is the difference between this time, between these tenses? So who can tell us about the difference? One person, please. So do we have any experts in grammar, in the English grammar, in the use of tenses? Okay, do you hear me? Arun Chalam,
Yes, ma'am.
Yes, ma'am.
Ma'am,
do you
present simple. Yes, ma'am.
okay?
Present simple is we are talking to a single person using the tense, which is present using the tense is or are, ma'am. And present continuous, it is we are right now talking to them using the word ing, ma'am. And present perfect is using the word will has.
Has.
Present,
Mhm.
yes, ma'am. Has have had. And present perfect continuous is will be having will have been.
So this
Perfect.
is have been doing something, for example, right? Mhm.
Yes, ma'am.
Okay, so you are speaking about the forms of how to form these the verbs in these tenses. Okay, so but I'm sure that you know this, and just to refresh in our memory, so the information about these tenses, the present simple. So there are several cases when it is used. It is used to talk about something that is true at the moment of speaking, some general truth. So I've got chest pains, or I'll feel better. So here. And the next, something that is happening on a regular basis around now. I get these headaches in the morning, usually every day, regularly. So this is the case. And a process. When I lean forward, the pain goes away. And the pain starts in my chest and moves up to my shoulder. So this is the way we use the present simple tense. The next slide is about the use of the present continuous. As you see, it is used to talk about something that is happening at the moment of speaking. As you've said, his blood pressure is rising. He's rising. This is present continuous. I'm having difficulty breathing. So then it is used also when we speak about something that is happening around now, though not necessary at the moment of speaking. Examples: are you taking any medication? So this week, for example, or this month. Or I'm having chest pains. So I mean around now, not exactly at this very time. And it is also used to talk about something that has been arranged for a date in the near future. Not exactly now at the moment, but in the future. So the example says, I'm seeing a psychotherapist next Wednesday. So it means that something is arranged for the next Wednesday and it will happen next week. Do you see? So this is one of the most interesting functions of the present continuous tense. Then there is information about comparison of the present continuous and present simple. So the use of have, the verb to have, in the present continuous to refer to the moment of speaking is more limited than in the present simple. You remember that some verbs are not used in continuous forms. So, and so the use of to have is generally restricted to expressions such as have difficulty plus gerund, doing something, for example, have something to eat, have a shower. So in these phrases, we can use the verb to have in the present continuous. So we can say we are having difficulties just writing letters, for example, now. Or he's having a shower now at the moment, and so on. And let us compare two just sentences. So moment of speaking, I've got a pain in my chest. And around now, I'm having pains in my chest. Not exactly now, but this week, for example. So we should keep in mind the difference between these two tenses. And if we move to the next slide, there is information about the use of the present perfect tense. And we use this tense to talk about a situation that begins in the past and which either continues up to the present or is related to the present in some way. So it doesn't tell us how slowly or how quickly something has happened, only that this is the way the situation stands now. And the example here is my headaches have decreased. We have some kind of result. So by now. And one more, the present perfect continuous tense. We use this tense in a similar way to the present perfect, but the continuous form describes a progressive change in a situation up to now. So my headaches have been decreasing, for example, for the last 2 weeks, or like this. And so it seems like we understand the meaning when we can use these tenses. And let us look at the next slide, which focuses on some practical exercise. And the question is, we can see the diagrams actually to the left, that the diagrams present so some just description of different tenses. And so you see the arrow, and PC stands for presenting complaint. So this is when a patient comes to the doctor, as you remember, and we can see the present simple. This tense describes the fact which we have now. Then on the timeline with the present continuous just describes something around now, not exactly at this very moment, but some kind of progress which started in the past, which is going on now at the moment of speaking maybe, and which will also go on for some time in the future. As for the present perfect, the action started in the past and it has some kind of result now, or it has finished till now. And the present perfect continuous also describes that the action has finished or has some kind of result at the moment of speaking, and it also describes how it was going on, the process, as you see. And so I think the task is rather easy. So we should just match sentences and diagrams. So sentence A. So I have a difficulty in pronouncing your names. I can see Shaikh Aymen, right?
Yes, ma'am. Amen.
Amen, sorry. Will you read the first sentence and match it with the graph?
Yes, ma'am.
Please.
So, ma'am, first sentence is I've got a headache. So, I've got a headache. So, ma'am, it is the word that is happening at the moment. So it is, ma'am, simple perfect.
Which
simple present tense.
Present simple, the first diagram, right? Okay. Samhita Prabhakar.
Yes, ma'am. I have been having this shooting pain in my leg. Ma'am, this is, since it has been having, then it is, has to be present perfect continuous.
So diagram number 4, right? So thank you. Prerna Mugam, please.
Yes, ma'am.
The next one, C.
I keep getting these flashing lights around my eyes and sharp pain. So he says that he keeps getting these flashing lights. So
This
my
is about
present
keep.
continuous.
Keep.
Present continuous.
So I mean, present continuous normally has the verb to be plus the main verb with ing. Yes, but here we don't have the verb to be, and we should focus on the verb keep, which is highlighted.
Present
in bold.
perfect.
Present.
Present.
Is it no present simple? Present simple, ma'am.
It is present simple.
Present
Present
simple.
simple, ma'am.
Present simply. Simple. Exactly. Mohammed Abdul. So the next sentence, please.
Have been having these terrible headaches, backaches, ma'am. Ma'am, it's a present continuous, ma'am.
Is it just present continuous or present perfect continuous?
Present perfect. Present perfect, ma'am.
Perfect
Present
continuous,
perfect
ma'am.
continuous, ma'am.
Present
Yes,
perfect continuous.
exactly right.
Continuous.
Okay. So do we have any other students? No. Yeah, so I mean, yes. Arun Chalam, the next sentence.
Ma'am, the pain goes right to you. Present simple.
Exactly. Then Nishat Afrin. We don't hear you. Will you switch on the sound, please?
Sorry, ma'am. The sentence is, have you been having any pain? Ma'am, it is present perfect continuous.
Exactly.
It's
So
telling about the pain which is having like started from the previous one and
mhm.
still going on.
Yes, yes, it started in the past, and so we emphasize that it was for a long time. Okay, let us listen
Yes,
to Prerna Mugam.
Yes, ma'am.
So this is
I'm getting these headaches off and on. So he says that he's getting, and the verb ing is there, so it must be present continuous.
exactly. Then Samhita.
Yes, ma'am. I'm not taking anything from them. I'm not taking anything from them. Ma'am, this
So,
is present perfect.
I'm not taking.
I'm not taking.
So at the
Present continuous.
this is present continuous. So just now at this around now. Mhm. And let us listen to Prakriti Pandeu.
Yes, ma'am.
Yes, please, the last one.
Ma'am, the attack have increased. Ma'am, present simple.
So heart attacks have increased. It means that they started in the past and they are still going on. And there is a kind of description of the change in the intensity. So it's another tense. What kind of tense is it? This is present perfect.
Perfect.
Present perfect, yes. If you do have any difficulties in recognizing the tenses, please find some kind of just book to revise the tenses and present tenses. I mean, just to be sure that you understand all the details. And if we move to the next slide, here we can have one more practical exercise. And here the task is to complete the sentences with the correct form of the verb. If for more than one tense is possible, let us explain the difference. So let us listen to Shaykh Emen.
Yes, ma'am. Ma'am, the first sentence is, my mother dash these pains since last Tuesday. She still has them. So, ma'am, it may be my mother is having these pains since last Tuesday, and she still has them. Is it correct?
I've missed it.
Having these pains.
Yes, this is has been having these pains. So because this is third person singular, mother, she has been
Yes,
having
ma'am.
these pains. Present perfect continuous. Okay,
Ma'am, it's continuous, so ing forms.
I see. Okay. And the next sentence, number 2, please, Madhumita.
Yes, ma'am.
Read number 2, please, and think about the form. This is the question.
ma'am. For a run at the same time every day. You normally go.
So will you repeat, please? As far as this is the general question, it starts with an auxiliary verb, right?
Yes, ma'am.
So,
Are you normally going for a run at the same time every day?
so you try to use the present continuous, but if we have this kind of phrases, every day, usually, every year, it's the time marker of a specific tense, which is called present simple. It's
Simple,
better to,
ma'am.
yes, it's better to use the
It
present simple.
denotes any kind of repeating action.
Yes, so it starts with an auxiliary.
Do you normally go for a run at the
Yes.
same time every day?
Yes,
Do you normally go?
Yes.
have normally also?
Yes,
Do you normally go? Okay, the next number 3 is Mohammed, please.
The pain dash a little since yesterday, it's better now. The
Mhm.
pain has eased a little since yesterday, it's better now.
Exactly.
It's present perfect now.
Present perfect. And the marker of the present perfect is the preposition since, the word since and for are normally the markers of the present perfect tense. So sentence number 4, Nishat.
Yes, ma'am. I have been lying in bed for 4 weeks and I haven't been out of it once, doctor. Present perfect continuous.
Exactly, because it's important to emphasize that the process was for 4
4
weeks.
weeks. Huh.
Yes,
Yes.
we need to use continuous, and as far as this is
Perfect.
till now, it should be
As well.
perfect. Perfect, present perfect
Yes.
continuous. So the next number 5 is Prerna, please.
I can see the rash dash. It's much redder. I can see the rash getting worse. So it is perfect. Present continuous.
Is getting worse.
Is getting worse.
Because I can see it now, the process of changing. And the next one, let us listen to Samhita.
I dash not take any medication at the moment. I am not taking any medication at the moment.
Yes, we have at the moment, which means we need to use the present continuous. And the last one, Shaikh, please.
Yes, ma'am. Dash to shoulder, or it is just there. The pain spread to your shoulder, or it is just there. So, ma'am, it
It
is
is
asking about
spreading
the
on
condition
pain.
at the moment. It's present continuous.
Okay, yes. Is it spreading? You mean? Is
Spreading.
any other tense possible to use in this sentence?
Is the pain spreading to your shoulder, or it is just there?
This is continuous. And as for other forms, can we use present simple, for example, here?
Is the pen spreading to your shoulder or is it
It is-
just there?
If
Here?
it is present
Spread it.
simple, in the present simple tense, when we ask questions or make negative sentences, we use specific auxiliary verbs. What are they in the present simple? Do or does, yes? So we say
Yes, ma'am.
Hmm.
Does the pain spread to your shoulder, or it is
The pain
just there?
yes,
Yes.
exactly, does. Okay. And let's move on. And here we are going to do like so to speak about our time is coming to the end. I have another class at 11 o'clock. That is why we need to focus on the task that you should prepare for the next class next week. I mean, we're going to do some culture projects, and so the culture projects, one of them will be connected with body language. And why is it important? Because being aware of your own body language and your body and the body language of your patients will help you in taking a history, will help the doctors in taking a history. So actually there is a definition for body language. This is the process of communicating without words, not verbal, through gestures and movements, you know this. And here, let us quickly look through the sentences which are presented here on this slide, and you can see 3 pictures. And so in each picture, there are some obvious signs of the emotions that the people experience. They show them through their body language. So, and let us match pictures and sentences. The first one, the doctor is more sure about what he's saying. Which picture shows this?
First one. A.
A picture, yes. It's like the doctor just touches his face with his the second one, the patient is not comfortable or at ease.
A C.
Right, yes. The next, the patient is angry.
In the figure diagram.
First one. A.
First one. A.
Yes, the woman is angry. She's using her body language, you know.
Body language to show.
Okay. Number 4, the doctor is bored and
C.
unsympathetic.
Unsympathetic.
Yes.
C.
C.
Exactly. Number 5, the doctor is showing interest and inviting the patient to continue speaking.
B.
In
B1.
the figure B.
Yes.
B.
Number 6, the patient doesn't understand what the doctor is saying.
A, ma'am.
A.
A or C maybe, right?
Yeah.
And
ma'am.
the last one, the doctor and patient aren't communicating.
C.
C.
ma'am.
C. There is no interaction.
So you can see that without any words, we can understand so what the person tells us. And so this is the task for the culture project number 1. So we have only 10 minutes left. So we'll have 3 projects, culture projects. The first one is we should use the internet to find information and make presentation. So the presentation should cover the following questions. Is body language important in your culture? How are gestures in your culture differ from other cultures? What are other fields besides medicine where understanding or not verbal communication is important? You should find this information on the internet. So talk to your friends, relatives, or from your own experience and make up a presentation, which should consist of about 5, 10, not less than 5, not more than 10 slides, okay? So it should include some illustrations, also some information, but it should be given in short, some key phrases, as you see. Well, then we have culture project 2. So the same, you should use the internet to find information and make presentation, which will tell us about the following. What does a patient-centered approach in history taking means? You should look for patient-centered approach in history taking, you see. And culture project 3, the topic is what is the Calgary-Cambridge method? You should search for this kind of method. So will you remind me how many students we have in the group?
12, ma'am.
Total 12 students.
12
ma'am.
students.
11?
Students.
12 students.
12, ma'am. One is not here.
I
At the
don't
moment,
understand.
At the moment, ma'am, one student is not attending this class. There are a total of 12 students.
And so how many students are there? I mean, should be there.
12.
12.
Yes, ma'am,
I see
12.
now. 12. So we can 12. We can divide the class into 3 groups. Yes.
Ma'am, we have already been divided, so we make the presentations in groups already.
Yes, ma'am. Since last.
You have this
We
kind
have
of
some
experience,
also.
yes?
Yes, ma'am.
Arunchalam, you'll
Yes,
be
ma'am.
just responsible for dividing the group into 3 groups,
Okay.
and each group will be working with one of the projects, okay?
Okay, ma'am.
And we'll start the next class with these information, with this kind of presentations, okay?
Ma'am, all the subgroups should do all the 3 projects only, no, ma'am?
No.
Ma'am,
Each group
Each
should be
one
working on one project.
Okay, ma'am.
Okay.
Ma'am, then, okay, ma'am. Ma'am, then can we be 4 in a group, ma'am? If we have 4 in a group, then we will do each 3 projects, 3 groups.
I'm not so good in
actually, ma'am,
mathematics.
we are a group of 3 groups we have 4 groups actually. Each consists of 3 students actually.
Ma'am, you please.
We can have 3
let
groups
us
consisting of 4
do
students,
the
right?
topic, ma'am.
Yes,
Or
ma'am.
else some will fight for the topics. You please divide us and can
You mean
provide the topic.
actually I don't have the list of of the students of your group. That is why I'm just.
Ma'am, I send you right.
Okay, I don't hear anything. No. Well, I'll clear out. I'll find the list of your group. But I think.
Ma'am, you can check WhatsApp, ma'am. I have sent the list.
Arunchalan, you should please. I see. Okay, I see your message. Please just divide the group yourself. Okay, it should be 4 students in each group. Yes. And one more task. As far as we missed the last week, but I need to just to give you grades for the previous week, the first week. So we need to do some. This is online learning, and this is the link to the futurelearn.com site. Here on this site, you should find the online course. The online course is called Healthcare and Medicine, and English for healthcare. And you should register for this course, and it lasts for 4 weeks. And this course is just rather easy for you, but anyway, you should do this, and you should complete week 1. Week 1, it consists of a number of tasks. You should complete week 1 till next Tuesday. Do you see? And it's not till next Tuesday, it should be till next this week, Saturday. Yes, the end of the week. And you should send me the picture of the screenshot, which shows that there should be your initials in the corner of this screenshot. It will be if you have completed, and it should show that you have completed week 1. This is kind of congratulations, you've completed week 1, or just week 1 completed. So, and you should send me till Saturday, so I can see that you've completed week 1 of this course. You understand? Do you understand?
Yes, ma'am.
Have you
Ma'am,
ever,
can you please?
Yes, ma'am.
have you ever
Can you
worked with this course?
No,
No,
ma'am.
ma'am.
No.
No, ma'am.
So,
Ma'am, can you?
any questions?
Ma'am, can you please share this link of this course?
You can just see I'll send this link. I'll send this presentation to the leader of your group, Arun Chalam.
Okay.
Okay, ma'am.
So, but I think I'll do it later today because I have classes now at 11 o'clock. Okay.
Okay, ma'am.
So,
Yes, ma'am.
and yes, in the afternoon.
Yes, ma'am, sure.
Unfortunately, your group is not in the Moodle because I used to work with students in the Moodle. And I think there's one more task that we need to complete till the end of this week. So I'll send this. This is a short task from the book. So, and yes, I'll do it later today.
Okay, ma'am.
That is all we can do. So, and yes. Mhm. Do you have any questions?